about antibiotic use and whether or not it should be restricted. We're going to talk about the background, types of antibiotics, what the problem is, resistance of different antibiotics, MRSA, MRSA, virus versus bacteria, advantages of restricting, disadvantages of restricting, what do we think, and any questions and references. First is a little background about antibiotics. When antibiotics were discovered, they were called magic bullets or wonder drugs because they were so effective in the treatment of sickness. However, as a result of the widespread usage of antibiotics, bacteria have evolved so much so that antibiotics are becoming resistant, or are useless because viruses are becoming resistant. And then we have a YouTube video about antibiotics.
Microbes, mostly tiny bacteria, make up around 90% of the cells in a typical human body and 10% of our body weight. Most of them are in our gut and on our skin. Many microbes are beneficial, for example helping us to digest our food. Only a tiny fraction cause disease and are usually kept in check by our immune system. But when they aren't, microbes also help us to fight back. Bacteria cause disease when they are able to reproduce in the body. They produce harmful substances called toxins, which damage tissues and organs. But in nature, microbes can also produce agents called antibiotics to protect themselves against competitors.
It's a tough world out there, and you might think that you just see competition in the savannas of Africa, but in fact the microbes fight each other as well. And in fact, like martial arts, they have ways of fighting other microbes with particular moves, and one move they have is to produce antibiotics. These are compounds that allow them to kill other microbes and take all the food for themselves, or the resources that they need. And so the competition between microbes results in these very sophisticated antibiotic molecules.
The discovery of antibiotics and their power to fight bacterial disease began with Alexander Fleming. He observed the mold Penicillium notatum accidentally growing on a sample of Staphylococci and saw it had killed the surrounding colonies of disease-causing bacteria.
All antibiotics work by disrupting a critical function in the bacterial cell. For example, penicillin, discovered in 1928, prevents the cell from renewing its cell wall during growth. Eventually, the cell wall weakens and bursts.
By the 1950s, the use of antibiotics had revolutionized the treatment of previously untreatable infectious diseases. In 1967, the Surgeon General of the United States of America, William Stewart, declared, "The time has come to close the book on infectious diseases. We have basically wiped out infection in the United States." But Stewart's optimism proved premature.
The bad news is that microbes can become resistant to antibiotics, and they can change their biochemistry in order to adapt to these antibiotics and prevent the antibiotics from damaging the cell.
It's standard evolutionary behavior. When bacteria reproduce, chance mutations occur. Most will be useless, but sometimes there will be one that will protect the bacterium against a particular antibiotic. While most of the bacteria succumb to the antibiotic, the one that survives goes on to reproduce and replicate the resistance, and bacteria reproduce very fast. Scientists are on an endless quest to develop new antibiotics to defeat resistant bacteria, so-called superbugs, but they must be used properly.
Widespread use or misuse of antibiotics for minor infections means that more bacteria become exposed, and so there's more chance of resistance developing and spreading through the microbe world.
GPs prescribe 133 million courses of antibiotics every year. It's estimated that 50% of these prescriptions are unnecessary, and by taking antibiotics that you don't need, you could be making yourself more at risk from the disease. If you don't complete your antibiotic course, you expose the microbe to concentrations of antibiotic which don't kill it. Some bacteria, such as MRSA, have become highly drug resistant. These superbugs aren't some complex and new set of diseases. merely variations of common bacteria that we used to find easy to control.
The good news is that scientists are developing new synthetic antibiotics that target resistant bacteria.
But who knows whether one day a mutated bacterium might become resistant to all synthetic antibiotics. A superbug.
So that was just kind of a background on antibiotic resistance. These are the major classes of antibiotics. They're aminoglycosides, beta-lactams, fluoroquinolones, glycopeptides, ketolides, lincosamides, microlides, oxazolidinones, streptogramins, sulfonamides, and tetracyclines. As you can see, there are many types of antibiotics, meaning that there are many chances for superbugs or antibiotic-resistant bacteria to form. So what's the problem? The problem is whether or not the use of antibiotics should be restricted. If antibiotics are used less, the bacteria will evolve less rapidly and antibiotics will still be effective for sickness. If they are restricted, people will be sick longer, there will be complaints, and people will have more difficulty building up a tolerance for these sicknesses. It is also a problem with ethics. Some may find it unethical to deny certain treatment to a patient because they know that it'll work. And also the drug industry might suffer because there will be less people paying for antibiotics. This is a graph of the consumption of ceftazidime and versus the resistance of that drug. Ceftazidime is an antibiotic used for treating bacterial infections. It is a cephalosporin antibiotic, which means that it works by killing sensitive bacteria. The graph shows that over the years, as usage of ceftazidime increases, the resistance usually goes up as well, except in the year 2001. Also, the percent resistance in 2003 to 2004 goes up, even though the goes down even when the usage goes up. This could mean that the resistance does not always go up when the usage goes up. Next is ciprofloxacin, and ciprofloxacin is used to treat or prevent infections caused by bacteria. It is also used to treat or prevent anthrax poisoning. It is in a class of antibiotics called fluoroquinolones, and it works by killing bacteria that cause infections. In this graph, the consumption and percent resistance of this antibiotic is directly related, aside from the year 2001 and 2003, where it's fairly low, but the resistance is fairly high. However, the year with the most consumption does have the highest percent resistance. This next one is imethanin. And imethanin inhibits bacterial cell wall synthesis to fight sickness. In this graph, it can also be said that the amount of usage directly affects the percent resistance. For instance, in 2002, the consumption of imethanin is fairly high. It's the greatest on the whole graph, and the percent resistance is the greatest also. The next antibiotic is amikacin. Amikacin is used to treat serious bacterial infections. It works by killing bacteria or preventing their growth. Amikacin is classified as an aminoglycoside antibiotic. In this graph, this one varies more than the others because the percent resistance is not clearly related to the usage. For instance, the highest consumption, which is in 2000, is the second lowest percent resistance of all the units on the graph. This graph is a comparison of the percent resistance versus the consumption of all of the four antibiotics on the other graphs. And this slide shows that the percent resistance of ceftazidime, ciprofloxacin, imethanin, and amikacin spanning from the year 2000 to 2004. The resistance of each peaks in 2002. The one that perhaps varies the most is the ceftazidime, which is, that one is a little bit different. So what does this mean? The graphs show that some antibiotics cause a higher percent resistance, and that generally, the more people use an antibiotic, the more risk there is that a bacteria will become resistant to the drug. This also means that there might be more concern in today's society, considering the fact that people use antibiotics fairly often. high use of antibiotics may mean a higher amount of superbugs. However, the fact that it varies somewhat may mean that it doesn't mean the same thing for each antibiotic, that maybe one causes more of a resistance, but then another just might not at all. Next we're going to talk about MRSA, which is methicillin-resistant Staphylococcus aureus. This term is used to describe a number of strains of bacteria, Staphylococcus aureus, and these are resistant to a number of antibiotics. MRSA can cause skin wounds and abscesses and problems with heart valves. There's a picture on there. There are invasive medical procedures that can cause infections in the blood or pneumonia. People with weakened immune systems require antibiotics to help clear these infections. So, we kind of had a video, but I don't think we're basically saying the same thing, so I don't think we need it. And it's basically like what the doctors say you should do to prevent things like MRSA. If you have a cough or a cold that are caused by viruses or viral infections, doctors should give you no antibiotics. When you do get antibiotics, you should finish them. You may feel better at first, but you still need to keep taking it as long as you're told to, because if you don't, it might not kill off everything. You might feel better, but there might still be some of it in you. And it can prevent bacteria from evolving into something that's resistant. And always keeping your hands clean, that's always kind of obvious, but it's a way to control infection from spreading because it helps rid your body of bacteria that you could potentially pass to someone else without even knowing.
Yeah, because that's one of the main ways that's spread in hospitals too, is from patient to patient's room. Doctors going from one patient's room to the next without, say there's some on their coat or on their hands if they don't wash them. Where does MRSA come from? It's from the widespread use of antibiotics. Bacteria is constantly evolving because genes are constantly changing. So as this happens, some build up a tolerance or resistance to certain antibiotics. Weak bacteria would usually be killed by the antibiotics, but not the kind that have already built up resistance. Those actually take longer to die, leaving enough time for their offspring to inherit the resistance. If you think about what could happen there is that the offspring would have further changes to their genes, meaning they'll become even more resistant to the antibiotic, and then so will their offspring over time. This is why doctors find it important to finish antibiotics, so that way the bacteria have a lesser chance of winning and spreading and a better chance of dying right away. Regardless, many people will just say, well, I don't like to take medicine, or it's already out of my system by now, so I don't need to finish my prescription. But it's really important to do that so that it prevents others from getting worse or from spreading the sickness to others or from having the bacteria form resistant strains. Bad news about MRSA, it can cause septicemia, which is blood poisoning, pneumonia, septic shock, bone marrow infection, inflammation of the tissues that surround the brain and spinal cord, which is called meningitis, infection of the heart lining, which is endocarditis, severe joint problems, which is septic arthritis, and internal abscesses. MRSA can become fatal in about 10 to 20% of cases, especially with older people in hospitals, like patients over the age of 65. Their immune system is already down, so it can become very fatal if antibiotics can't work against the resistant strains. This kind of just compares by country. You can just kind of tell that it goes up for every year. It's gone up almost every year because the tolerance or resistance that the strains have formed. Next slide. And then this just shows in Seattle, even though it's just one state, you can see that it's gradually increasing. It's getting worse every year. I'm going to move on to MRSA, which is vancomycin-resistant staphylococcus. It's a specific type of antimicrobial-resistant bacteria. It was the only uniformly effective treatment for staphylococcus infections, but vancomycin was. However, in 1997, the first case of MRSA was reported. The Staphylococcus aureus had a reduced susceptibility to vancomycin. By June 2002, there were 8 confirmed infections with such strains reported. The good news is that as October 2010, all MRSA isolates have been susceptible to all other FDA-approved drugs, meaning there are now drugs that can treat this. Okay, How to correctly use antibiotics. Antibiotics used correctly can be instrumental in saving lives. However, they cannot be expected to cure every problem someone has. The most common use for antibiotics is to treat bacteria-caused infections, including tuberculosis, salmonella, and some forms of meningitis. However, they are not used to treat organisms such as viruses or fungi. It's important to remember that antibiotics cannot treat viruses if you think you have a viral infection. Viruses are the cause of many common upper respiratory tract illnesses, including the common cold and sore throats. So a virus is a microscopic organism that lives as a parasite in plants, animals, and bacteria, and it consists of one nucleic acid core within a protein sheath. Head colds, muscle aches, sore throats usually last from 7 to 14 days. These are just viruses. Bacteria are single-celled, often parasitic organisms without distinct nuclei or organized cell structure. Bad bacteria causes certain serious illness such as pneumonia, meningitis, dysentery, blood poisoning, and all those can be life-threatening. When to take antibiotics. They don't work against viruses, but instead those should just be treated with over-the-counter medicines or non-prescription drugs such as herbal decongestants, cold formulas, and cough syrups. Bacteria is best treated with antibiotics, but overuse can lead to bacteria becoming resistant. But then again, so can not finishing a prescription of antibiotics. Because as I said before, the strains could become resistant if you don't kill them. Okay. Then we had some advantages of restricting. Antibiotics would work for sickness longer. Bacteria would evolve slower. It would give researchers time to find another treatment that may be more effective in treating sickness, and our bodies would build tolerances to sickness after we have them. Disadvantages of antibiotics. People would complain because some might not understand why the restriction is necessary. It could also be a problem of ethical concern because people aren't going to understand why it's important to withhold treatment if we can be cured, that it wouldn't be right for the doctors to not treat you. Also, people could be sicker for longer, and then drug companies might suffer on top of that. Some other disadvantages, unfortunately, antibiotics cannot differentiate between good and bad bacteria, and they just destroy all of them. So this is especially a problem in the gut, and it can cause very serious consequences, as the good bacteria aids in digestion, boosts our immune system, and wards off allergies, assisting in the elimination of harmful toxins. The main point is that we need the good bacteria in our stomach still, and sometimes antibiotics can destroy that. There are negative side effects also of taking some antibiotics. Some of these are just feeling sick in general, diarrhea, fungal infections of the mouth and the digestive tract, but there are more serious side effects such as the formation of kidney stones, but these are considered rare. Also, people can be allergic to antibiotics, but there are generally other prescriptions available for these cases. What do we think? We think that they should still be used, but with restrictions. Obviously, it's important to build resistance against bacteria, but if antibiotics are essential in killing and preventing bacteria that have formed strains, we still think we need it for that reason.
And basically, we think that, or at least I think that they should still be used, but not for things that we could get over with just staying in bed for a couple of days. Like something that's more mild, you don't need it. But if it's something like if you're really sick and you do need it, it's important to take them, but to take them like as your doctor's orders, like take them for the right length, even though you may feel better and you may think you're okay again, but you need to like finish off killing the bacteria.